Good evening, everyone. Thank you very much for joining us this evening for this webinar, which is being hosted by AHDB Beef and Lamb. My name's Mary Vickers, and I'm the Senior Beef Scientist for AHDB. We're delighted to bring you tonight's webinar, which is about responsible use of antibiotics on beef farms. Our presenter this evening is Dr. Alex Corbishley. Alex has practiced as a farm animal vet and is currently a lecturer and researcher in farm animal practice at the University of Edinburgh. The plan of action for this evening is that Alex will take us through a presentation, and then there will be some time for questions and comments at the end. You will all be muted throughout the webinar, but if anyone would like to ask questions at any time throughout the presentation, then please type those into the box on the right hand side of your screen, and when Alex has finished, then I'll be able to ask those questions for you. There shouldn't be any problems, but if there are, do bear with us and we'll try and sort them out as quickly as we can. So without further delay, I will hand over to Alex for this evening's webinar.
Thank you very much, Mary. So as Mary said, this evening we're going to talk about responsible antibiotic use on beef farms. I'll start by talking a little bit about the context behind antibiotic use and why we're so worried, and where we think the beef industry probably sits in the bigger picture. Talk a little bit about how use relates to resistance and why that's important, and then really spend most of the second half of the presentation talking about how that practically translates on farm and the sorts of things we need to be focusing on to reduce the amounts of antibiotics we use in beef production. So firstly, we're thinking about antibiotic use in farm animals and how that relates to risks to human health. What are the key actions that are driving responsible use of antibiotics? And then looking at different beef systems, what are the key drivers of use in those systems? And what easy wins are there? So what can we do in the short term? And then what might take a bit longer and need more sort of sustained concentration and investment to reduce antibiotic use? So firstly, it's worth asking why antibiotic use has suddenly come under the spotlight. And even though we've known about antibiotic resistant infections for a long time, it's really been relatively recently that the cost to that to human health has really come to the fore. And this was driven by a report by an economist called Jim O'Neill a few years ago now, commissioned by David Cameron, that looked at how antibiotic resistant infections might affect human health over the next 20 to 30 years. And we can see here that at the moment, across the world, there's around 700,000 people a year that die of antibiotic resistant infections. But the projections going up to around 2050 is that this could rise to around 10 million, which is more than the number of people that currently die of cancer. So the potential human impact of antibiotic resistance is significant. And for that reason, in this report, Jim O'Neill looked at various areas where antibiotics were used and therefore where we should be looking to reduce use and therefore reduce resistance in humans. And agriculture was one of the major themes that came up in his reports. And there was a specific document really looking at use of antibiotics in farming. So what does antibiotic use look like in farming, and how does the UK compare to other countries, predominantly across the EU, but also some key other countries elsewhere in the world? So he looked at this in his report, and we can see that if we consider antibiotic use that's normalised for the weight of animals, so milligrams of antibiotic per kilo of animal in the country, we can see that the UK sits roughly in the middle. So it's between 50 and 60 mgs per kilogram. And I'll show you some slides in a minute that show you that that's actually started reducing. So there's quite a few countries that use a lot less. Some of that's cultural, but some of it's also due to the different structures of their industry. But if we look at countries like New Zealand up here, we can see usage levels much, much lower. Of course, we can see other countries that you might expect to be quite high, like the USA is high, and then some of the Southern European countries are high. There are some question marks over the reliability of the data for Cyprus. But the point of this slide is really just to say, in terms of what we're using in farming, the UK is pretty much average, and there's a big range between countries that's driven partly by farming system and partly by culture. So what's been the trend since then? Where's antibiotic usage heading? And the good news is that in the UK, at least, use in food production seems to be declining. So in 2014, it was around 62 mg per kilogram, dropped to 57, and then in 2016, it's dropped to 45. So that's a good news story. And it's also worth looking at some of the more important antibiotics. So antibiotics can be divided up into the ones that are very, very important for human health, and they're considered the highest priority, critically important antibiotics. And I'll look at those a bit later in some of the subsequent slides. But also here, a good news story in that in 2012, we were using around 66 mg per kg total antibiotics. But if we look at our critically important antibiotics, we're using much less of those. And over time, we've been reducing that. So between 2015 and 2016, we dropped the amount of fluoroquinolones that were being used by about a third. And colistin has almost completely disappeared from use. It's very low levels now being used. So good news in terms of trends, but there's still quite a lot of antibiotics being used in food production, and that's still receiving a lot of attention from governments and regulators when thinking about human health. So why do we worry about human health, and how is it that use of antibiotics in farm animals actually relates to resistance? Well, antibiotic resistant bacteria exist everywhere. They're all around us. They've been around for hundreds of millions of years. So if we take a cow, for example, that's got bacteria in it, it'll have bacteria in its guts, it'll have it on their skin, she'll have bacteria on her udder. Within that population, there will be the odd resistant bacteria just naturally there. That's true of the environment, so there'll be passing feces into the environment and there'll be resistance there. And that's true on meat as well. If you go to a supermarket and look for antibiotic resistance in the meat on the supermarket shelves, you will find it. So it exists all around us. The issue comes when we use antibiotics, because when we use antibiotics, we kill all of those susceptible bugs. So we leave behind the resistance ones. And if we do that at very high doses for a long time or repeatedly, then what we allow is for those resistant ones to multiply and to outnumber the susceptible ones. That animal or animals that have been treated are then able to contaminate the environment with much higher levels of resistance, both in watercourses, in the environment that people might come into contact with, and then also coming through into the food. And the important point here is this applies to the good bacteria. So these are the bacteria that just normally live on our skin or the cow's skin or in our guts, and harmful bacteria. So why is that relevant? Well, good bacteria, also called commensal bacteria, can become resistant to antibiotics if we use them repeatedly in farm animal production. Now, we might have harmful bacteria, ones that are harmful to humans, ones that are harmful to animals, or zoonotic bacteria that are harmful to both humans and animals that are actually still susceptible to antibiotics. So we want to treat a disease and we use the antibiotics and that works no problem. But we have this resistance in our good bacteria. And bacteria are able to share this resistance with each other. So they can transfer from the good to the bad bacteria, turning that into a bacteria that's then resistant to infections. And that is called horizontal gene transfer. And that's been the big driver behind the concern of antibiotic use in farm animals, potentially contributing to disease in humans. So that's a quick whistle-stop tour of the theory and the context of why antibiotic use has come under so much attention. And as an industry, we're really trying to focus on responsible use. And by responsible use, what we mean is using medicines as little as possible, but as much as necessary. What we don't want to do is move to a zero antibiotic world where sick animals that are in need of treatment don't receive the treatment that they need. So when we're talking about using as little as possible, we're really focusing on reducing the disease risk. What can we do about our system, our nutrition, our disease status to ensure that we really don't need to use antibiotics? In particular, this is thinking about farming systems and farm management and making sure that we're not using medicines as a substitute for good farm management. In terms of as much as necessary, what we mean here is about using the antibiotics that we've got carefully, following the dose and the course that is recommended by your vet, and making sure that we're storing them correctly and we're observing the withdrawal properly. The whole concept of using as little antibiotics as possible should be a win-win for producers. And the reason for that is that antibiotics are generally used to treat infections once we've already had losses within a system. So it's sort of pouring money after a loss that we've already had. So if we're able to prevent disease and therefore reduce the antibiotics we're having to use, then we're actually saving money on two fronts. And these numbers, which admittedly are a few years old now, but the proportions probably still hold true in terms of where the relative costs of disease sit. Medicines in pneumonia, for example, are only around a third of the disease costs. The vet fees is around 10%, but what really has made up the majority of the cost are the weight loss at around 40% and the mortality at just under 15%. So over half the losses during a pneumonia outbreak are related to weight loss and mortality rather than the medicine and the veterinary fees. So for that reason, if we're improving health, we shouldn't just be reducing antibiotic use, but actually reducing profitability and output for the farm. And really the final point is that there's increasing retailer and consumer demand to reduce the antibiotics that we're using. And there are more and more supply chains where they are asking the question, how much antibiotic was used in this animal's life or in this production system to produce a carcass. And that's likely to only increase in terms of retailer and consumer interest in the amount of antibiotics that are being used. So in terms of thinking about responsible use, we can borrow from the parasite treatment manuals some of the concepts around that. And in the parasite control manuals, they talk about the 5 R's of responsible use, and they also apply to antibiotic use. So what we mean here is thinking about the right product. So what is the most appropriate active ingredient? What's the most appropriate product to treat that infection? And talking to your vet and getting their advice is really important here, because there are some antibiotics that just won't work for certain infections. We need to think about the right way of giving that drug. What's the most appropriate route? If the drug is for injection under the skin, then it needs to be given under the skin and not in the muscle. If it's for injection in the vein, then it's best given in the vein rather than under the skin. Thinking about the right time. So how many times should that treatment be given and how often is it required? And kind of going with that is the right rate. Do we have the right body weight for the animal? It's not uncommon to see animals that are being dosed at a 200 kilo rate that may be weighing 400 or 500 kilos. So making sure that we've got the right dosage in the syringe and we're giving the doses at the right timings is really important to making sure that we get the best chance of treatment success and reduce the risk of resistance developing. And then finally, making sure we're treating the right animals. And really in terms of antibiotic resistance, this is thinking about routine group treatments. Now, whilst there may be systems where antibiotics are still having to be given to groups of animals to control disease, that should be done in direct consultation with your vets. And just blanket treating whole groups of animals because that's what happens every year shouldn't be the way forward for the industry. We need to be thinking about ensuring that treatments are given as needed on a specific disease basis rather than as part of a blanket routine treatment protocol. It's worth thinking about the assurance schemes. Red Tractor have recently changed their requirements this summer relating to the review of veterinary antibiotic use on the farm. They've produced a pro forma sheet that could be part of that review, but generally most health plans and most conversations with your vets would cover the majority of things that Red Tractor are looking for. But they really are focusing on reviewing the antibiotics that are used on the farm, how that's related to disease rates, how they can be driven down within that system, and also thinking specifically about these highest priority critically important antibiotics. And these are a specific group of antibiotics that have been defined by the European Medicines Agency as being of specific concern to human health. And they should only be used on assured farms now if their use is supported by your vet and on the basis of some testing on your farm. So that might be samples that have been taken from the farm, sent to the lab and analysed for resistance to those antibiotics, or it might be based on diagnostics done on your farm that have said, these are the diseases you're struggling with, and therefore we need to use these antibiotics because they're most appropriate. So I've mentioned twice now these highest priority, critically important antibiotics, and they do cause a bit of confusion. And the reason for that is that there are 78 different brand names that fall into this highest priority category. But because of the number of generics that are now on the market, there's only actually 7 antibiotics that we're thinking about. And I've listed them here, and they're things you can check on the side of packets of medicines that you may have on the farm. But they fall into 3 categories: these 3rd or 4th generation cephalosporins, the fluoroquinolones, and colistin. And the real point here is that these are essential antibiotics in human health. And it's actually very difficult to justify their use on most beef units. So if these are active ingredients that are being used on your farms, it's worth really thinking, is there diagnostic and testing evidence to justify using these antibiotics? Or could we be using things like penicillins or tetracyclines instead of these? These should only be used when there's no other choice available. So where has the beef sector set out its stall? What sort of targets have been set? Well, looking at the targets that were set out a year ago, it was declared that the beef sector would aim for a 10% reduction between 2016 and 2020, or to reach a level of 10 mgs per PCU. And PCU is an EU term for essentially milligrams of livestock. There's a few technicalities about how that's calculated, but the key message here is 10, whichever is the lower based on this measurement. Now, this year, the VMD have recently released an estimate of usage in the beef sector, and they estimate that it's around 18 milligrams per kilogram within the sample of farms that they looked at. So in the next 2 years, we've got to nearly halve our usage to hit that 10 mg per PCU number. In terms of the highest priority, critically important antibiotics, then the commitment has been to monitor what we're using and aim for a 50% reduction between now and 2020. So some pretty ambitious targets for the beef sector over the next 2 years. So with that in mind, it's worth thinking about what the key drivers are in different systems. So first, thinking about the beef from dairy system, there are some big differences here depending on how that animal has been treated early on in life as to the number of antibiotics treatments it's needed. So this data here is looking at the treatments per 100 calves on 2 different beef from dairy systems. In this column here, we have lifetime antibiotic treatment for calves that have been reared on the dairy or that they were born on. So it's one dairy farm producing beef calves as a side business on those farms. And there's a number of dairies in that data set. And then here we have calves that were taken off a number of dairies, put onto a single rearing unit, and then their treatment rates whilst they were on that rearing unit. And we can see here a substantial difference in treatments. So calves that were reared on their dairy of birth, around 11 per 100 calves needed treatment during their whole lives. Around a 15 per 100 needed treatment for respiratory disease over their whole lives, and then around 4 per 100 needed treatment for other reasons. That compares to over 130, so calves were getting more than 1 treatment each just during the rearing period if they were taken off a number of dairy farms and put into a rearing pen. So there's clearly a lot of progress to be made in terms of reducing antibiotic use on some rearing systems. And in terms of immediate action, the relatively easy wins at the start, it's worth reviewing the hygiene of the system and general respiratory disease risk factors and vaccine use. So when we talk about respiratory disease risk factors, we're thinking about the number of animals in a batch, the housing of those animals, the chilling that those animals might be going through, their nutrition, all the things that you'll talk about with your vet as part of a health plan that may be contributing to respiratory disease. It's certainly worth looking at milk feeding practices. Are the calves receiving sufficient milk solids to ensure good immune function as well as growth? We can think about how we use antibiotics for dairy-bred calves on a rearing unit. Specifically, these calves often get diarrhea, but they shouldn't be getting antibiotics to treat diarrhea unless salmonella has been diagnosed. And it's also worth reminding ourselves that paramomycin, para-4, is an antibiotic and it's not licensed for treating crypto. So paramomycin really isn't appropriate for cryptosporidium treatment. If we've got a mycoplasma problem, which most rearing units will be treating for mycoplasma, then we shouldn't be using fluoroquinolones unless that's supported by some robust on-farm testing. And really, one of the most obvious ones that can have a really big impact on medicines usage is ensuring that all calves are BVD tag tested negative or from accredited dairies. Ensuring that you keep BVD off a rearing unit is one way of really ensuring that you limit one of the major risk factors for respiratory disease on those farms. So what about things that can be done in the longer term to try and drive down disease rates and reduce the amount of treatment that's needed? Well, building relationships with source dairies has to come high up the list. If you're building up relationships with those farms, then you can look at colostrum management, ensure those calves are getting the best start to life, and also looking at vaccine management. If calves are not being moved until 2 to 3 weeks old, then there are some vaccines that can be given prior to movement to try and reduce the respiratory disease risk. We often talk about limiting the number of source dairies in a batch and reducing the fill times. If you can get a lot of calves onto the farm in a short period of time from a small number of dairies, then we know that we can reduce the number of treatments compared to if we're bringing in calves from 60 different dairies, let's say, over a 4 or 5 week period. Looking at the buildings, the ventilation, whether the calves are being exposed to drafts and high levels of moisture will help to drive down disease risk. And then also thinking about the stress associated with the transitions within this system. So can we reduce travel times between the dairies and the rearers? Can we minimize the group mixing once they're on a rearing unit? And can we look at ways of matching diets either before or after they arrive on the rearing unit so that we don't have transport stress, group change stress, dietary stress, all these stresses occurring at the same time and tipping those calves over the edge? More philosophically, we probably need to think a little bit as an industry as to whether systems that rely on routine group antibiotic use, so I'm talking here specifically about in-milk antibiotics, whether in the long term they're sustainable or will be acceptable to the consumer. And if we decide that that's maybe not the case, then thinking a little bit about how we need to evolve calf rearing systems so that those that are heavily reliant on group treatments, can you move away from those for controlling respiratory disease? So what about suckler systems? Well, there's relatively little data out there in terms of what suckler farms are using. We've looked at some preliminary data of our own and have seen that there is a big range in usage in suckler farms, from some farms using almost none to others using similar levels to what you would see in some of the beef from dairy systems. So being a suckler farm doesn't automatically make a farm a low user. In structured interviews with farmers, then it wouldn't be much surprise to yourselves to see that respiratory and diarrhea outbreaks are two of the big key drivers of medicine's use. Things like difficult carvings and cesareans. But a few other things that came out that surprised us were some farms giving routine antibiotic injections to all their calves at birth to try and prevent navel and joint ill. Some farms using dairy antibiotic dry tubes in their suckler cows to try and prevent summer mastitis in dry suckler cows. And then other uses, so some farms using antibiotics in foot baths to control digital dermatitis, and also during outbreaks of New Forest eye. So just like in the beef and dairy system, then there are some commonalities here. So reviewing things like hygiene, respiratory disease risk, and vaccine use, of course, are important in a suckler herd. As is BVD. If you can ensure your herd remains BVD free and you've got the right biosecurity, then that's removing a big risk factor for other diseases. Looking at some of the results of these structured interviews, however, it's clear that there are some things we could probably just stop doing and find better ways of controlling. So not using antibiotic dry cow tubes in suckler cows, not using routine antibiotic injections at birth, and not using antibiotic foot baths to control digital dermatitis. And just with the beef and dairy calves, unless we've got a salmonella diagnosis, we shouldn't be using antibiotics to treat diarrhea. And again, with mycoplasma, we should only be using those fluoroquinolones if we've got real evidence to support that. So there's some commonalities there between the two systems, but a few key differences that are worth bearing in mind. In terms of the longer term objectives, thinking about monitoring and improving colostrum antibody passive transfer in newborn calves is worth considering. We've done some work this year with AHDB, and we reckon around 1 in 3 calves would have benefited from more colostrum this year that we sampled. We need to think again about the stress associated with transitions. So can we do things at weaning to reduce stress? Can we avoid abrupt diet changes, either in store cattle or at the time of weaning? What can we do to improve buildings? And what can we do to review our medicines records to kind of drive further investigation, look at where we're using antibiotics and address those key times in our system where we have a disease problem that needs treating. And one case study of this that we were involved with here up in Edinburgh was a 300 to 350 cow suckler unit that contacted us in the first month of their calving period. So this here's the day of the calving period, and this is the number of calves they had born on each day. And we've coloured in the calves that needed antibiotic treatment in the first couple of weeks of life in this sort of aqua colour. And this farm, without really realising it, had ended up having to treat around 1/3 of the calves that were born in that first month of life with antibiotics at the start of their calving period. So we were asked to look into this in a little bit more detail. None of the signs of those calves were very consistent. They were suffering from lots of different diseases. There was no single disease that these guys were treating for. So we decided to blood sample a group of calves for antibody passive transfer. So this is how much colostral antibody these calves had got from the cow through the colostrum. And we can see here, out of the calves that we tested, only 2 actually had good levels of antibodies from mum in their blood. So on this farm, they were actually suffering from a widespread problem of poor antibody transfer to the calves. And it was that was driving this antibiotic use, with 1 in 3 calves needing antibiotic treatment. And once this was addressed and the antibody supply to those calves from the cows was improved, then antibiotic use in this herd reduced 3-fold. So it's just one practical sort of real case example where a herd had really been struggling with high levels of antibiotic use and had managed to look at something very different to actually drive that use down in their system. So thinking a little bit about colostrum feeding specifically, the Canadians have done a bit of work on this to try and identify calves that need help with colostrum supply, and they looked at calving ease, and they looked at the chances that a calf would fail to get up and suck colostrum. That's what this is here at the bottom. And calves that had an unassisted calving had only an 8% chance of not getting colostrum. So they had a pretty good chance of getting the colostrum they needed. But those that had just an easy pull, so without a calving jack, but there had been some interference from the stockman, went up to 1 in 4 chance of not getting enough colostrum. And those that needed a calving jack or a vet assistance ended up with a 1 in 2, a 50% chance of not getting enough colostrum. What they also looked at was the quality of the suck reflex in these calves. And they showed that if the calves had a weak suck reflex, this is the dotted line, then their chances of not getting enough colostrum increased substantially. So that's 3 in 4 calves that were born without any assistance that had a weak suck reflex didn't get enough colostrum. And for those that had any assistance at calving, you're looking at the vast majority of calves not getting up and drinking colostrum within 4 hours. So the message from this work from the Canadians is that really, if any calves are born with assistance, or if they've got a weak suck reflex at 10 minutes old, then they need to be given help with colostrum. They need additional colostrum. And when we talk about additional colostrum, we're talking about 3 to 4 litres immediately after calving. So just some very specific advice that's coming out of some of the studies abroad, but really looking at ways that we can improve one of the big risk factors for antibiotic use during that very early stage, and that's the amount of colostrum that suckler calves get once they're born. Other things to think about, I mentioned stress before. I've often heard things like, I believe in getting everything out of the way in one go, so I'll do all the stressful things in one go and then leave the cut-off be. It's generally a bad idea. What we want to do is avoid lots of stressful events at the same time. So if we can stagger things, if we can make sure that transport and weaning and diet changes don't all occur at the same time, then we reduce the risk of tipping that animal over the edge and then it's suffering from something like respiratory disease. When we're disbudding or castrating, then giving some anti-inflammatories to those animals will also help. And if there is the capacity to do lower stress weaning practices, if respiratory disease after weaning is generally a problem, then that's something that's worth considering as well. So finally, thinking about growing and finishing systems, I think it's worth noting that there are many units that achieve almost negligible use. And that's really be to commended as an industry, that there are many growing and finishing farms that use very little antibiotics at all. Those that do use antibiotics are really using them for respiratory disease. That's the predominant driver of antibiotic use once animals get to that age. And to really get on top of that, you need an integrated management approach alongside your vets. So that's thinking about risk-based vaccination, thinking about ventilation, if possible, getting vaccines into calves 2 weeks prior to that risk period. So get them fully vaccinated 2 weeks before you're going to house them or transport them. Matching diets again, and then trying to adopt and maintain a batch system so that we don't have lots of calves of different sizes and ages and disease risk in the same pens. That should then help ensure that we're avoiding the mixed age groups. And then I've already mentioned stress a couple of times, making sure that we've got good handling systems, and then things like feed and water trough access are unhindered, so we're limiting stress on those animals. And then finally, but certainly importantly, controlling other diseases. So we've mentioned BVD a couple of times. Parasites, particularly liver fluke, can have a big impact on the immune system and therefore respiratory risk. And then other things like coccidiosis as well may be important on some systems. So thinking about airflow and humidity, if you've got poor airflow, then you're going to have more bugs in the air. There's going to be more dust, more ammonia, more hydrogen sulfide. All of these things damage the airways. They compromise the protection of the airways. And they also increase heat stress in older animals. And it's not uncommon, even with our cold winters, to see animals sweating up in sheds in the wintertime because they've got quite warm at the high levels of humidity that we have. So to try and mitigate these risks, trying to keep that relative humidity under 75 degrees as possible, and trying to make sure we get a decent number of air changes every hour. Even if sheds generally look good, beware certain parts of sheds, there might be microenvironments where there's quite poor ventilation in certain parts of the shed. Thinking specifically about dust, dust really does damage the airways. You hear a lot on the news about fine particles affecting children in big cities like London. It's no different if cattle buildings are very dusty. Think about types of bedding, so very poor quality straw or mill wastes might create lots of dust depending how they're being distributed and used in the shed. So think of the quality of what's being used. And then also beware of straw blowers. So they're fantastic for reducing labour input onto a farm. They're very popular in a lot of farms, but particularly in small cattle under sort of 250, 300 kilos, they are quite susceptible to the dust. So if it's possible to move the animals out of the pen before bedding down, or particularly in the smaller animals, consider not using the straw blowers to reduce the amount of dust those animals are breathing in, and therefore the risk of respiratory disease. I don't have time to go into detail about how cattle buildings are ventilated. I wanted to put this slide up just to remind you that there are some great BRP manuals that look at ventilation and respiratory disease risk that are available on the AHDB website. The core principle though around the stack effect is that you're aiming to have the air above the calves moving. So you're having lots of inlet above and then an open ridge or a breathable roof that's allowing plenty of airflow above the calves to get that get those bugs and get the dust away from the animals, whilst at the same time trying to reduce the amount of wind chill that calves are suffering from, particularly small calves. So to make sure that I've left sufficient time for questions, I'll sort of wrap up there. But just in summary, to remind us that antibiotic-resistant bacteria really are a major concern, specifically to human health, but there are problems with resistant infections in animals as well. The blanket routine group treatments are no longer really the way forward for the industry. And thinking about putting in place really clear treatment protocols with your vets, investigating disease problems well so that we can get to the bottom of risk factors and reduce the need to use those antibiotics, and also reduce the losses that we've suffered from those diseases. And to think about how we can drive down use through things like good biosecurity in husbandry, eradicating BVD, and then in particularly young calves, whether they're beef from dairy or suckled calves, excellent colostrum management. And there's been a concerted effort across all the livestock sectors to focus on the real benefit that colostrum gives to newborn calves. So with that, I've run over by a few minutes, but I'll hand over back to Mary, who should be able to field any questions that there are.
Okay, thanks very much, Alex. That was great. So now is the time to ask any questions if you'd like to. So just type those into the box on the right-hand side of the screen. We've got a few coming through. Whilst I'm waiting for those to arrive, just to remind you that our next webinar is about selecting beef cattle for slaughter, and that will be next Tuesday, the 4th of December, with Steve Powdrill, our national selection specialist. So that's one to register for if you're interested in selection for slaughter. Right, we've got a few questions, so I'll read those out. If I can just sort out my screen. So you were talking about the industry targets that have been set for reducing antibiotic use, but do you know what will happen if those aren't met?
I don't know, actually. As a livestock sector in general, the government's sort of taken a view that the industry should take a lead on it and get overall usage down as a livestock sector, and that if we don't, that there may be legislation that comes into force for that. At a sector by sector level, I'm not really sure whether the government has really thought about those different parts of the industry, because clearly there are certain parts of the meat production chain that are using a lot higher levels than others. I don't know if Mary's got any other insights than that I have.
No, I don't know. I think they're certainly letting us take a voluntary approach at the moment, and they're certainly pleased, I think, with progress. But yeah, we've got to reach those sector-specific targets if we possibly can. So I can't be any more specific than that either.
And I think if we look at other countries, just very quickly, other countries have been much more sort of forceful in saying, if you don't do this, there will be legislation brought in to make changes. So I think the UK has taken a slightly softer approach than that, but there is clearly precedent for a much more prescriptive approach by government.
Yes, absolutely. So the next question is about colostrum management in sucklers, and what are your views on bricks testing of colostrum?
Okay, so the bricks, just for those of you on the call that haven't seen bricks refractometers before, they're a little device you hold up to your eye and you put a drop of colostrum on them. They've used commonly in things like cider brewing, so you can buy them on eBay for around 15 quid. So they're things that everyone can have on farm. They're very good for determining whether a 2 or 3 litre colostrum, what I'm trying to say, if you've got 2 or 3 litres of colostrum in a bag, they're very good for working out whether that colostrum's good or not. So there's been a lot of work done in the dairy sector to show that if you test that colostrum and it's above this 22% cutoff, then it's good quality colostrum that you can feed to calves. So they're very valuable in that respect. If you're storing colostrum and you want to check its quality, then they're very, very useful. If you want to use them on individual cows, then it's a bit more tricky, because really you need to strip the whole cow's udder out and then test a little bit of the milk from that udder. So they're very good for stored and managing stored colostrum, It's quite a bit more effort involved if you actually wanted to use it on an individual cow basis.
Okay. Any suggestion that colostrum quality is lower in heifers than cows, or is that purely diet dependent?
So there's a nice Irish study from 2006, it's a few years old now, where they showed quite convincingly that the quality is no different. So the amount of antibodies per litre of colostrum is very similar between heifers and cows, but heifers produce less of it than cows. So the total number of antibodies that a heifer produces is about half of that of the cows, and that's because of the reduced yield rather than the reduced quality. So yes, you are going to get fewer antibodies from a heifer into a calf, but provided you get the right volume in, then the quality is generally comparable.
Okay, great. So there's a bit more interest in how do you know exactly when a calf has got a weak suck reflex?
So that work from Canada, what they've done there is they've put their thumb in the mouth of a calf at around 10-15 minutes old, and they're seeing whether that calf is really showing a strong jaw tone, so the jaw's moving with good strength in that jaw muscle, and that it's making an effort to suck your thumb. And the point they're making there is if the calf isn't doing that at 10 to 15 minutes old, then that is a calf that has a very high risk of not being up 4 hours later and sucking from the cow. So it's trying to identify the calves that are most in need of help with colostrum. And if they don't have that reflex when you put your thumb in their mouth and they've got a good strong jaw and they're moving their tongue and trying to suck your finger, then those are the ones that are at that higher risk.
And is there any issue with administering colostrum via stomach tube? Do you risk stopping the calf working out how to suckle itself?
So there is a risk, but it's not stopping the calf from learning to suckle itself. So the risk is that the tube goes down the wrong hole, so it goes into the airway, and that really is fatal for the calf. That will drown the calf. Now, with a bit of training, if anyone's not done it before with your vet, then it's very easy to avoid that because you can feel the tube going down the neck if it's in the right place. So in terms of interfering with the calf's development and its ability to learn to suck from mum, it doesn't interfere with that, but it is very important, obviously, that the tube goes into the right place.
Okay, and you said where you find calves that haven't had enough colostrum, administer sort of 3 to 4 litres of colostrum immediately after calving. So is that via a stomach tube, and do you give all that at once?
Okay, so it can be through a bottle or a stomach tube. That tends to be stockman preference. Really, if you're using a bottle, then it's being patient enough to give the calf time to drink it. It will take a calf around 20 minutes of vigorous sucking to get around 3 litres in. It's perfectly safe to give them 3 litres in one go. The general recommendation is 10% of body weight, but it's just much easier to remember between 3 and 4 litres for a newborn calf as soon after birth is practical if you need to supplement them.
And then I guess this question relates to people that are buying in fairly young calves. No, actually, probably this is when you're on the farm where the calf has been born. Is there any test you can do to know if the calf has received sufficient colostrum?
Yeah, there is. So it's something that I'm quite interested in for the beef and dairy sector. It's something that we've talked to a lot of suckler farmers about this year. If you blood sample a calf between 2 and 7 days of age, every single vet in the country can do a relatively cheap test in their own practice to measure the amount of protein in that calf's blood. And that gives us a pretty good idea as to whether those calves have had enough colostrum or not. So if it's a suckler herd, it's not too difficult to take some blood samples from 2 to 7 day old calves. We'd normally talk about doing between 15 and 20 on a farm to get an idea as to whether the calves in general are getting enough colostrum on that farm. In beef from dairy, it's a bit trickier because you're often not seeing those calves until 2, 3, even 4 weeks old. And in that instance, that's where having that continuous ongoing relationship with supplying dairies, if that's possible and practical for you, does allow you to say, right, well, actually, I would like your vet to test these calves when they do their fertility visit, so that we've got some idea as to how colostrum management is progressing. And that might be something that's done routinely, and there are certainly dairies that for their heifers do that on all of their heifers as a part of the way they manage their team on the farm. That would be particularly very large dairies. However, it could be done in response to problems or as part of an audit if you're looking at potential things that might be impacting on the health of the calves that are coming to you.
Okay, thank you. You talked a lot about calves with diarrhea or scour, and unless it's salmonella, you wouldn't necessarily want to treat with an antibiotic. Is there any test that a farmer can do to know what is causing a scour or a diarrhea?
So it's a good question. So it's something that is probably worth talking about your vet in a bit of detail, because the thing is with diarrhea is that it's quite often the age of the calf that gives you the best guess as to what bug it might be. So if you're getting lots of diarrhea in calves under a week of age, then actually it could be something like E. coli, and using some antibiotics for those calves may be warranted. But actually, if we got a colostrum better in that system, you'd probably see those diarrheas in that first week of life disappear. If it's calves that are sort of 1 to 3 or 4 weeks old, then you're typically looking at viruses and crypto. And then in calves older than that, you're typically looking at cocci, and then in calves of any age, salmonella. In terms of that specific question that was asked, there are SNAP tests, which are little tests that can be done on a bench top. Some vet practices stock them, and they will look for some of those diseases. Certainly not all of them, but they will look for some of those diseases. And they can be used either on farm or just in the vet practice very quickly to work out whether those diseases seem to be important in that system. The problem is with salmonella is that you do need a lab diagnosis. Generally, though, if there's a salmonella problem, you sort of know about it. It's not just diarrhea. The calves are very sick. They've got high temperatures. It's quite fatal to weak calves. So if there's a salmonella problem, you'd find normally you'd get to identifying that as quite quickly. And I think the important point here is sort of, I've raised some key points in these slides, but it's really talking to your vet, because if there are specific things on your farm that need antibiotics, then by all means you need to use them. But for a lot of diarrhea cases, they're likely to be viral, they're likely to be cocci, and in those instances, antibiotics are not the right thing to use.
Okay. Right, so we've got someone who's asking how much of an issue is antibiotic resistance on UK beef and sheep farms at present?
It's a good question. And in terms of that specific question about resistance to antibiotics, we don't have a lot of good data. So there's been plenty of work done in dairy, but in terms of beef and sheep, understanding the amount of resistance on those farms and where that resistance is and how that translates into resistance in meat, that work hasn't really been done in a lot of detail. It's certainly, the little bits of data we have would suggest that it's not as widespread as in some of the other production systems, but there will be hotspots where resistance is quite high. So the sorts of places you'd think about would be lambs where you're getting blanket treatment with an oral antibiotic at birth. You would expect to see quite high levels of resistance around that time. Beef from dairy systems where the calves are getting in-milk antibiotics, you would expect to find quite high levels of resistance during that time as well. But unfortunately, we don't have a lot of good, reliable UK-wide data to tell us how much of a problem resistance actually is.
Okay. So I've got one more question, just to hint if anyone else wants to quickly ask a few more, otherwise this will be the last one. So at what point would you start feeding suckler cows to improve their colostrum? And I suppose, what would you feed them with?
Okay, yeah, it's a good question. It's something we've thought a lot about with AHDB this year. So we're really typically talking about the last 3 or 4 weeks before calving. That's the time when we want to make sure the cow is having all of her current needs met. So if we need to get condition off cows, we can be relatively harder on them during mid-pregnancy, during months 7 and 8. But once we're in that last month of gestation, so about 3 weeks before they're due to calve, that's when we want to be focusing on getting the right nutrition for good colostrum production. In terms of what we need to feed them, then it's really making sure that they're getting the right amount of protein. And when I say protein, I don't mean soya. I'm talking about rumen protein that we find in very high levels in grass silage, rape meal, those sorts of protein sources. And we're not talking about a lot. We're talking sort of probably around 10 to 11% crude protein, depending on the type of feeding system that you have. As a general point, a cow at the point of calving being fed reasonable quality grass silage or out at grass and getting good dry matter intakes will certainly have enough protein to produce the colostrum she needs. A cow that's just on straw and minerals will not be getting enough colostrum to produce, will not be getting enough protein to produce the colostrum that she needs. Hopefully that's specific enough. Obviously, I don't know what exact system the person who's asked the question is using.
No, but just need to get a full formulation for the whole ration that the cows are being fed, I suppose, as a starting point.
Yeah.
So I haven't got any more questions, so I'm going to round it up there. So thank you very much, Alex, for that brilliant presentation and the discussion, and thanks to everyone else for participating and asking questions. We have recorded the webinar, so that will be available on the AHDB YouTube channel, and a link will be circulated to all those who registered. So I think that's it for this evening. Thank you all very much for joining, and have a good evening.
Thank you.